Hey everyone, we are excited to launch the Bright Mind subscription. Unlimited access to all of our CE courses, webinars, and expert speakers all in one place.
And for a limited time for the month of December, you can get 50% off. Normally $299 a year, now just $149 for your first year.
That's unlimited CE on your schedule for half price.
Head over to psyched2practice.com and click sign up, and the discount is already applied. We look forward to seeing you there. And as always, be well, stay psyched. This episode of the Psyched to Practice podcast is sponsored by PAR, where psychological assessments meet innovation.
PAR has been the gold standard in the industry for over 45 years and has empowered professionals in education, healthcare, private practice, and research with trusted tools and cutting-edge solutions.
Discover more at parinc.com. Again, that is parinc.com. Creating connections, changing lives. Hello and welcome to the Psyched to Practice podcast, your one-stop for practical and useful clinical information, masterful insights from experts in the field, and a guide to daily living. I'm your host, Paul Wagner, and Ray will be joining us in just a few moments, but I want to take a moment to introduce our guest for today. So we both had a chance to sit down with Dr. Laura Knouse and talk about her recent book, Living Well with Adult ADHD, which is a part of the Living Well series through Guilford that Ray and I have been able to interview a number of guests. And, this one is no different. It is such a wealth of resources from some really useful and helpful just tools within the book itself, as well as it's written to be interactive with clients, but it's also just a great clinician's review of how we can better support our adult ADHD population and being able to adapt CBT for it. She does a great job this episode, being able to break down how we can really leverage something that I know many clinicians are very familiar with, but being able to do it in a way that really is attentive to the specific struggles that adults with ADHD have that show up in their daily life, and being able to provide some practical strategies and really grounded in a CBT framework that, if you do have a background there, it really sounds familiar, and it's making some small tweaks to really see a big change. So I think it's a great resource here. For those of you who aren't familiar with Dr. Knouse's work, she's a professor of psychology at the University of Richmond and a licensed clinical psychologist. She researches and writes about how cognitive behavior therapy for adults with ADHD can be implemented and improved, from how college students with ADHD can study more effectively to how avoidant automatic thoughts may hinder the use of CBT skills. Dr. Knouse has published more than 40 peer-reviewed articles and is co-authored in Thriving in College with ADHD, a cognitive behavioral skills approach, and Living Well with Adult ADHD, practical strategies for improving your daily life. With that, we hope you enjoyed this Masters in Practice episode, Living Well with Adult ADHD.
Laura, thank you so much for joining us on the Psyched to Practice podcast. We're excited to have you on to hear about your work and also talk a little bit about your new book. So thanks for joining us.
Absolutely. It's cheesy to say, but I'm totally psyched.
Hey, that's it.
That's what we're here for.
That's good. That's what we're looking for. That's right. So, Laura, before we kind of get into the content of the book, we like to start out and let our listeners kind of get to know a little bit about our guests. And we always kind of say we want to know their origin stories. So, just kind of interested, can you tell us a little bit about how you got into psychology and then the specialty of adult ADHD?
Sure. Yeah, I think those stories are pretty intertwined. So I guess the best place to start would be thinking about my undergraduate experience, and a little bit of connection to that. I do teach at an undergraduate focused institution and do a lot with mentoring new clinical psychology researchers. And so in some ways, I feel like through my job, I get to give back in that way because I went to the University of Richmond and was able to, as an undergraduate, just receive really high quality mentoring and research opportunities. And so probably the thing that most directly brought me to where I am today was doing a summer research fellowship after my junior year of college. And that was in the lab of Dr. Russell Barkley at the UMass Medical Center. So that was a cool opportunity. I was actually the first intern that they had summer research undergraduate intern in the psychiatry side of things. Mostly they were mentoring bench kinds of projects and things, but I got to work on a project with a driving simulator. So this was kind of back when we were still discovering all the ways that ADHD really can impact the different areas of adults' lives. And so we were running folks through driving simulator. And I got to add some of my own measures to the project, looking at people's awareness of their own driving impairments. It turns out everybody thinks they're an above average driver. Right. But since our folks with ADHD sometimes have trouble with that, right? There's like a kind of a bigger gap there. And I actually got the opportunity to publish that undergraduate honors thesis in adult ADHD, which was awesome.
Wow.
And so really from the beginning, before I even went to graduate school, I knew that adult ADHD was something I was interested in. I also my secondary interest area has always been cognitive psychology. So anything to do with learning and memory. And so that's always been a nice confluence there. And so I was really lucky to be able to go to graduate school at UNC, University of North Carolina at Greensboro, that has a specialty ADHD clinic. So I got to do a ton of assessments with adults, some treatment with adults, although at the time there wasn't a lot of guidance about what are the best treatments for these folks. And then I really hit the jackpot when, for clinical internship, I matched with Dr. Stephen Safran at Massachusetts General Hospital, who did the first randomized controlled trial of a CBT for adult ADHD. And that was obviously, for where I am now, a really wonderful experience. And so that really is where my specific kind of expertise in the CBT approach for this set of problems kind of comes from. From there, I went back to the University of Richmond. And so, like I said, my teaching work has been more undergraduate focused. But being at a place like U of R, I have a ton of flexibility to do all different kinds of research projects. And so I've done ADHD related projects that come from that kind of learning and memory angle. So like, what are the best ways for college students with ADHD to study effectively, things like that. And then also more recently, looking at more of the daily experiences that people, including people with ADHD, have in those moments when they're in what I like to call avoidance mode. So what are the thoughts and emotions that come along with those moments? And then how do we use our awareness of those to maybe wedge some skills in there? Right. So those are sort of two areas that I've looked at. Yeah. And here I am today.
Wow. Well, I kind of feel like as an undergrad, if you get to work in Russ Barkley's clinic, you just have to specialize in ADHD. Like there might not be another path after that experience.
There's so much truth in that. And you know, I would say for all of my mentors, just so grateful for the opportunities that I've been given. And like I said, through my job at U of R, really trying to like pay that forward.
Yeah, absolutely. So, we're excited to kind of talk about your book about adult ADHD and, specifically around cognitive behavior therapy. So, we are CBTers by nature. So we, this kind of is a topic that's, something we're always interested in. So I guess maybe to start out, to just kind of maybe a overarching kind of understanding, tell us a little bit about how a cognitive behavioral model applies to ADHD.
Thank you so much for this question, because I think I see even among CBT people when I go to conferences, maybe somewhat of a bit of a misunderstanding of sort of basically the C and the B components, if I can say that. Like I see descriptions when public facing descriptions that are like, well, CBT is all about working with your thoughts. I'm like, hey, don't forget about the B. There's a big old B in that CBT. And I would say that particularly for people with ADHD, the C, of course, is important. We're going to hopefully talk a lot about that. But the B, the behavioral, right, the skills and the strategies is really, I personally, when I do this work, and a lot of the approaches that have been developed really do start with that B piece and using the C piece when other kinds of things are getting in the way of the skill use. So I'm going to take Steve Safran's model for CBT, the CBT model of adult ADHD, and talk about that. And so, of course, it's taking that traditional thoughts, influence feelings, influence behavior, and all around in a circle, and looking at how the developmental process of having ADHD earlier in life kind of shapes those interactions. Because, of course, well, maybe I shouldn't say of course, but it's important to say, we're not saying that our dysfunctional cognitions or even our behaviors really are causing ADHD itself. So in this model, we look at ADHD as mostly genetically influenced basic difference in sort of neurobiological and behavioral functioning. And we know from research that this is a condition that 80% of the variance in it is heritable. So it's about as heritable genetically as human height. And so sort of the basic characteristics or traits that lead into ADHD, such as difficulty with executive functions, with self-regulation. There's a lot of, they sort of are kind of feed into the model, but CBT doesn't explain where those come from, if that makes sense. However, if you are a person that is coping with these self-regulation deficits throughout your development, on the behavioral side of things, those symptoms can make it more difficult to use the very self-regulation skills that could help you with your executive functioning. So you have a bit of this double-edged sword situation. And so sometimes we see people come into the clinic and they've developed a whole lot of great coping skills. Other times they have kind of gaps in their coping skill profile. And so the B side of things, and let me say, no matter how skillful you are, we can all learn better self-regulation skills, right? Especially since we now have devices that we all carry around that are designed by corporations to take our attention and divert it, right? So in some ways, not to get too off track, this work is fun to do as a clinician because you're really talking about ways that not just your client, but any of us could be better at self-regulation. And so that allows for a lot of creativity and co-creation, which I'll set aside for the moment. So we've got our behavioral side, but then our cognitive side, right? If you are a person with ADHD, we know from research and of course, just from working with our clients that there are huge social impacts to the disorder, right? Being forgetful, looking like you don't care about things when really it's your symptoms that are getting in the way of keeping your promises to other people, impulsive behaviors that can get negative social feedback, right? Classic things like, not working up to your potential, right? Like getting messages from parents or teachers that you are lazy or not capable, right? And of course, these have an emotional cognitive impact. And so we think about the ways in which those stories that you've written about yourself based on the input of others, that's what you're projecting into the future. If you're encountering, let me try this self-regulation skill. Well, why should I even bother? I'm not the kind of person that can do this or can accomplish this. And so that's where the C piece of it really comes in. J. Russell Ramsey, who does a lot of work in the space and is wonderful, has a book called Rethinking Adult ADHD, talks about a fundamental self-mistrust as sort of one of the core kind of schemas that adults with ADHD struggle with. And so that was a long answer, but hopefully that gives a little bit of sort of what we see with the B and what we see with the C. And then we'll make some of the intervention strategies that are suggested kind of make sense within that model.
And now a word from our sponsor. PAR's AI Report Writer is an AI-boosted tool that generates comprehensive reports, including interpretations and recommendations based on scores from a wide range of popular assessment tools. Spend less time on report writing and more time supporting students. Learn more at parinc.com/AI. That is parinc.com/AI. And now back to our conversation.
And I'm so grateful, and as our audience knows, so I'm an adult with ADHD, and recognize that and identify that later in life, and the research that been able to consume since then, it's gone back and made so much sense, and especially those cognitive elements and those cognitive pieces of it, and recognizing that self mistrust or those. I can't recall if it was Russ Ramsey or Ari Tuckman who talks about the lies we tell ourselves, and that being able to, just those automatic thought processes that can occur. And so really emphasizing the importance of the behavior, but not losing sight of the cognitive element. But really, there's almost a separation where I think that's an important distinction, because a lot of CBT, that's not quite the case. We see it as this intermingling and blending, but it's not that they stand alone, but it is really nuanced comparatively to some of the other implementations there. Am I hearing that right?
I find myself wanting to chew on that a little bit and compare it to some of the other CBT approaches, because I think it is nuanced because, and I'll tell you one way that it's different, I find, is that, I think because cognitive therapy originally, was developed for the emotional disorders, right? Depression and anxiety. There's this real focus, understandably, on negative automatic thoughts and thoughts that are accompanied by negative emotion, and using that as the emotional component to help clients identify what thoughts are important, which I think is totally right and totally applies, we know, to adult ADHD from both the research and the clinical side. But I think one thing that is nuanced in adult ADHD is that a lot of times there are maybe automatic thoughts that don't look negative on the outside, but actually can be sort of problematic, like this lies we tell ourselves. So that's what some of my work I've been doing with my students is on. We call these avoidant automatic thoughts. So they could be negative, like, oh, I can't do it. Or it could be kind of positive, like, oh, look at my calendar. I have plenty of time to do that tomorrow, so I don't have to work on it right now. Or here's one. I can just finish up this one more thing before I leave for that appointment. Can you? So, and this was my work at Mass General. And this was the beauty of clinical psychology, where you're seeing this stuff in the clinic and you come back around and fold it in empirically and into your model. We were seeing this with our clients, and they were identifying these as problematic. And then like, okay, how do we use this to understand? So I do think, I don't know if that directly kind of speaks to what you're talking about, but I think there are not just nuanced, but things that are, you can't just, I don't think, import whole cloth like the model that's used with other disorders and sort of slap it on. In fact, there's a great paper by William and colleagues who have done research using the what's it called, in the National Health Service in Britain, where CBT is the standard treatment that people receive, but it's CBT for depression and anxiety flavored CBT. And they've showed through some qualitative work that adults with ADHD say, when this is not tailored, it is not working for me. So that sort of shows kind of what we probably would know as clinicians, right? If you're not taking into account the condition, it's not going to be as effective, and it's not going to meet the needs of your clients. Yeah. So I appreciate that question, and I'm going to chew on that a little bit more.
And, maybe, when we're talking about these different models, one of the most common ones, and one of the ones I know I talk about a lot with clients, is, I'm not a prescriber, but talking about medication and the way that medication can be such an impact. And so from your experience, like, how does medication fit into the CBT model here? And like, what are the ways they interact? Yeah.
I'm a big believer in any tool in the toolbox. I know probably most therapists are, but I do feel like occasionally we can get a little bit too much into this either or, like, I don't hate this phrase, but sometimes the skills, not pills phrasing, I think, can sort of have this subtle idea that somehow skills are morally superior. I don't think anything that relieves human suffering is necessarily morally superior or inferior on its face. And so, and we just know from the research, these medications are probably among the most powerful and safe that we have in all of the psychiatric pantheon in terms of doing what they can do for clients. Now, that doesn't mean they work for everybody or that everybody's going to want that, but I think it's kind of nice because they fit in that model I described quite well, in the sense that they're turning down the volume on some of these basic neurobiological symptoms. And so they can, I think, work really well in tandem with the skills that we're trying to teach. Of course, making it easier maybe to learn skills, making it easier to implement. I think probably it changes your mindset when you see that, oh, actually, like this medication, it's not changing who I am. At least, hopefully, it shouldn't be. Your dose is too high if that's the case. But that, with this little nudge, like I can use this as a tool. And I think, again, I don't want to get too far afield, but I think developmentally, when we move into the adult period, like say you've got someone who's been diagnosed as a child, like it's so important to do the necessary psychoeducation so that someone who has been taking medication since they're a kid understands how are these working, why are they working, really taking ownership of that as a tool rather than something that's being like imposed from the outside. And I think we don't, as a field, we do a bad job of psychoeducation about meds, like especially in earlier developmental periods. Like there's no kind of recommended, how do we talk to kids about what's going on with this medication? How do we talk to adolescents? And so I think just like any good therapist, that medication piece should be part of your psychoeducational process that you're going through at the beginning of the work. And so, I see meds as very complementary to what's going on. And really, you're not a prescriber. I'm not a prescriber, but, we can educate ourselves about the medications and helping your client, like if they're not getting an optimal medication response, helping empower them to work with their prescriber to, kind of reduce side effects and increase the positive impacts.
And I'm so grateful. I know we're talking about the adult population here, but the importance in those earlier developmental stages for that psychoeducation. And I'm reminded of a specific client who, when he started taking medication, saw a lot of improvements, but then parents started sharing like he's resisting taking the medication. And in our conversation, he shared, well, they like the pill, not me. And that was such an important piece. And and being able to frame that as, someone can have the best tool, but it's how they're using the tool. And so we're talking about his mastery of being able to use this as an effective tool to get the most experience out of it versus, you can take the pill and it can maybe improve our ability to focus on something, but where you're directing that focus and the intervention we're using to transition, that is him. And like being able to differentiate those pieces there, I think is such a crucial element. And, I'm grateful to hear that. And you used a term, turning down the volume on some of the symptoms. And is that really kind of, really a parallel to that term in the book? I believe it was like that outside in and reduction of symptoms and the role that medication can play. Is that kind of what you're meaning with that phrase? Yeah,
I think what I meant by that phrase is that it's not going to eliminate the symptoms, but it might decrease their severity. And of course, we know with these medications, one of the downsides of stimulants is they're short acting, right? And so all of the new formulations are all about how do we make the effects last longer without messing up your sleep and all that sort of thing. I think it's related to the outside in. So I think of skills as, inside out. I think about the medications as helping with ADHD from the inside out. We're going to sort of take the brain process that is, related to the symptoms, and we're going to turn down the volume. So I guess it is related from the inside. And then from the outside in, that's where, of course, the skills that you are learning, and a big thing I want to emphasize is, and this part can be super fun, like how do you hack, I use the term hack, your environment so that it supports self-regulation. So I have no idea where this quote came from. I did not make it up, but I heard somewhere that the best self-regulators are working to put themselves in situations that don't require self-regulation, right? So things like very simple things that I'm really bad at, not going to bed with your phone nearby. It's not fair to trust yourself to have to self-regulate around these big temptations. And so that can look like a lot of different things. That can look like I said, blocking access to these distractors. I have a whole part in the book that's like, could be kind of fun, like go through like crafting your ideal, like kind of study. If you're talking about college students, or like ideal work environment, like really getting an idea of what distracts you, not just in terms of your visual, but like auditory, tactile, like all of that stuff, and sort of engineering that. It also looks like a lot of putting things where Russ Barkley would say at the point of performance. So we know ADHD is not a deficit of sort of knowing what to do. It's the problem in doing what you know to do at the time and the place that it's required. So an issue of, Russ Ramsey would say, implementation deficit. And this is very Russ Barkley-esque. How do you set up the environment so that the prompts are at the place in space and the place in time that are going to cue the behavior that you want? And embracing that kind of principle, like the book talks about a lot of specific things you can do with that. So putting prompts like notes to yourself in different places, or, different reminders on your phone. But if you kind of get that general idea, and I had this experience writing the book, you can generate a lot of kind of super interesting and cool strategies that can help cue the behavior you want. I'll give you a quick example for myself recently that happened. So I didn't share this. I'm actually on sabbatical in Japan right now. So I am.
Oh, wow.
Yeah. I normally am, in a house with the rest of my family and stuff. But here I'm living in a very cute little on-campus apartment. I am the only quote unquote adult in a whole dorm room of first-year students. And I think they're probably like, what is this lady doing here? But in Japan, sorting and doing things with your trash is super important. And so I have gotten into really being good about sorting my trash. And when I need to take it downstairs, I kept thinking like, okay, like when I go out the next time, I'm going to take the trash out. And I just kept every time not doing it. So finally, I just took the trash bag and I put it right in front of the door, because I'm like, I can't leave without taking this trash out. Now, something small like that is not in and of itself going to change anyone's life, but I do see the potential for like people to get creative, and these incremental strategies. I mean, they're going to make a difference in the aggregate, and they're also going to give people they're going to give people wins, and they're going to give people like success experiences to be like, look, like that, this isn't a fixed state that I am in. Yeah, it's a challenge because of my symptoms, but I have the ability to acquire new skills and like engineer my life in a way that's going to help me get to my goals, even if it's like little things. And I think we know as therapists, this is maybe just me. Sometimes I'm a little skeptical when there are two radical changes all at once. I'm like, is this a real one? Like, I don't act that way towards the person, right? But sometimes I do find that I have a little bit more trust in these incremental changes, because the person can really they've got to really take them on board in terms of taking ownership, right, of these wins, and that can really get the behavioral momentum like moving in a good direction.
And I love that example, and like that, you can't help but then at least be aware of the trash needing to go out when you're at that point.
I have to make a conscious choice to kick it aside, which I don't.
Yes. And I'm curious, I guess, working on some of the cognitive elements of that, like where some of the perfectionistic tendencies or expectations can come in, and where like, yeah, that works that time, but I know me, and I know I'm not going to do it all the time. So what's even the point? And like kind of like that, like dismissiveness that can occur. Like, how do you typically, approach that when working with this population?
I think that's so important. And I will just say too that some of the research studies that we have really do validate that perfectionism as a, of course, it's not only problematic in ADHD, but for many clients with ADHD. I think first of all, just having enough clinical experience to sort of solicit that and like, okay, so what is your mind telling you when because not all, you might have clients who they're trying to be a good client, right? So they might not even articulate that that's kind of going through your head. Yes. So I think kind of like, I guess I might fold that into general like barriers assessment. Like, okay, this works. So tell me like, what are going to be the barriers to doing this long-term, and, what are the solutions there, and making sure that those barriers you're soliciting are also like what's going through your head. Like, what are the stories that you're telling yourself? And I think it's a lot about, I think some of it is about normalizing it, being like, well, of course you've done it the other way for X number of years, and your your brain's job is not to make you happy. It's wired for survival, right? So it's automatically negatively sort of valenced, right? Or it's gonna make the kind of more negative prediction about the situation. And then of course you have all this life experience we just talked about where it has been difficult to be inconsistent. And so I think you normalize those thoughts. You also normalize, I was going to say failure, but I wouldn't frame it that way. You normalize inconsistency, right? You're not going to from the get-go be using this strategy every single time. And sort of getting them to think about, and this is something I did a lot in the book, like think about even if you could make a 10% positive change, accumulating that over days and moments of your life, it's going to have an impact. And so just encouraging that more flexible, incremental thinking, I think can hopefully be helpful. I hope that's a good answer to that.
I really like that, especially that 10% piece. And I think it puts it in a different way, in a context that I don't think happens in some of those really just quick, rapid fire, negative self-talk moments that I hear in these sessions. And I'm curious, a part of that as well, of being able to really identify what is the goal, and is the goal for this intervention to constantly work, or is the goal for the trash to get out? And so being able to say, okay, if this doesn't work, that doesn't mean it's a failure, but being able to adapt. And at times, and bringing the terms a lot of the individuals I work with know the term metacognition. Just go over it again and again. But how do we keep that? You use a reference of a compass in a way, what's our heading? And so even if we change our position, how do we still have that same heading of working towards that specific goal? And so if it's at times in front of the door, if at times, you have it sitting on, in front of your shoes, if at other times, if it's I'm just going to put my phone on top of, as long as it's not gross. Let me put my phone on top or my keys on top, because I know I'm not going to leave it. But if I don't want to get up off the desk, so being able to have those variety as long as they're still structured. I think even some of that adaptivity. And I think there's parts that you were sharing there of being able to normalize that inconsistency. And I think leaning into that as well can be such an important piece. And, I'm hoping for our audience being able to kind of hear and the importance of the creativeness that's involved in working with these individuals here.
Yeah. I really resonate with that, because I think I almost wanted to say we all struggle with it. I want to first, before I get into that, say that we do need to I need to recognize when I speak that it genuinely is going to be harder for people with ADHD. We don't want to normalize so much to the point where we're we'll just do this and it's going to work. So you're simultaneously validating, right, that it's going to be more difficult, but also validating the humanity of difficulty in changing behavior, because I think at times I've had some clients where I suspect and then find out that some of their resistance to trying new skill, so for example, in the Saffron program, and this is how kind of I operate, one of the first things you get in place is calendar system and task list system. Because the idea is you're going to have no chance of doing important things in the future if you don't know they exist, right? But I think a lot of clients come to something like a calendar or an agenda with just so many perceived failure experiences. I've tried this, And so I think sometimes you can try to assess, are there sort of specific thoughts there that might be getting in the way of even being willing to try? And I think for some clients, there's this idea that if I was quote unquote normal, I wouldn't have to use these quote unquote tricks to function as an adult. When in reality, I think all of us as adults have to use a ton of tricks to make the things we do in adulthood are not inherently reinforcing a lot of times, right? In the immediate sense. So I think we all are using strategies. So at the same time, normalizing the use of strategies whilst validating that the very use of those strategies is genuinely more difficult, and that we're going to work together through those difficulties. And that one way to address those difficulties is to really focus on tailoring the implementation of the skill to you specifically in your specific situation. Not having it be, any old calendar system is going to work. No. We're going to work iteratively to figure out, is it paper? Is it Google Calendar? Is it, And then also normalizing that even if you get a skill online, life circumstances can change and you might fall off the wagon for better, for lack of kind of a better metaphor there. And the idea that that is just a normal thing that's going to happen. And I mean, it doesn't feel good, but how do we make it so that it doesn't feel so bad that you're like you're saying, you're having these thoughts that are like these metacognitions that are like, well, I'm just not the kind of person that's going to be good at this ever. So why bother,
Yes.
And Laura, I wanted to jump back for a second. So you had made a comment earlier about when we were just talking about CBT and ADHD in general, and said, that I guess the study in the UK, I think you had said, was just using regular CBT. And so when I hear that, just for our listeners, so when we're talking about CBT, specifically for adults with ADHD, I guess, can you kind of give us, how's that look different? Like what does it look like compared to what most of us think of as just traditional CBT?
Sure. Right. Yeah. And I'm glad you brought that up because I do think we have a real branding problem in CBT because really there is no generic CBT, even though we all kind of know what we're talking about, right? I think we know we're talking about like depression, anxiety. Yeah. And I think that branding problem kind of can be a challenge for this approach specifically because, like you say, it does look different, right? Steve Safran used to say, we have a little bit of a challenge implementing this because let's say we're talking about anxiety, for example. You're kind of like doing one overarching procedure, right? It's exposure plus the cognitive components of exposure, right? Whereas in CBT for adult ADHD, you might be implementing all kinds of different strategies depending on like what the challenge is that the client brings to the table. But I can say that from looking at all the flavors of CBT that have been tested so far, some common elements, I guess I would say, emerge from those CBTs that have empirical evidence that they're effective. Okay. So the first big component is the behavioral skills and strategies that help with executive functioning deficits, or I don't know, executive functioning is a fine terminology, but I just always say self-regulation because that's really what we're talking about, and clients understand more what that means. So behavioral skills aimed at self-regulation. And so there could be like a lot of different skills you could put in that bag, but we're talking about the consistent calendar and task list system. We are talking about anything really that you could put under kind of organization and time management. So once you get that task list system online, a way to prioritize tasks and then decide kind of what to work on first, planning skills, that sort of thing. Very related to these organizational skills. And when I kind of do CBT, I think of them as really in the same category, but they really are a little bit separate and important, is the motivational skills. So we would think of these more specifically addressing procrastination and avoidance kinds of behaviors. So really important things here are breaking tasks down into smaller units. I call this the look up the telephone number strategy because I, despite being extroverted, hate calling people on the phone who I don't know. And so I would just say to myself, okay, you just have to look up the phone number. You don't actually have to make the call. But of course, once you look up the phone number, you're like, all right, I'll just, call it, whatever. So helping clients, I say to clients, make the first step so small that you don't look at it and feel, and even if you just do that little piece, that's something. So that's an example of more of a motivational kind of strategy. Motivational, I think of Mary Salanto's approach, which metacognitive therapy was the original name of her approach. Then it needed to be changed because there's another metacognitive therapy that's, for anxiety disorders. But anyway, she really does a lot with this, thinking about thinking and how to work with that with people. And her approach has some additional kind of great motivational strategies. Use of things like mantras to sort of help motivate certain behaviors. So one of the mantras in Mary's approach is, if it's not on the task list, it doesn't exist. So things that can just help remind you and motivate skill use. So we've got our organization and time management. We've got our motivational kinds of related skills. And then definitely sort of the more cognitive emotional pieces that we've been talking about. And I think, so you can, and in Steve Safran's approach, you can, if you're a CBT therapist who knows depression and anxiety, you can pretty easily import a lot of those kind of tried and true, like daily thought record kinds of, strategies that you might use with somebody, asking them to become aware of thoughts based on the kinds of cues you would use for somebody with depression, anxiety, like when do you notice a big shift in your mood, like that sort of thing. But where I would say you adapt it is also getting people to think about, as soon as you've realized you've gone off the self-regulation track, like, can you think about, okay, what happened in that moment where I made a choice to do this instead of the skill? And often you're going to see, it could be a negative thought, like, right, like, I'm never going to be good at this, so why bother? But it could also be like, I'm just too tired in this moment, or I don't have to write that down. I'm going to definitely remember that, which as a person who is now over 40, that to me right now is, I have that thought and I'm like, you're deluding yourself, like write it down. So yeah, I think those are the three biggies where you have overlap. And then sort of around the edges, you've got some approaches that much more explicitly incorporate a mindfulness-based perspective. So using mindfulness skills, there's some emerging evidence that those approaches can be helpful for adults with ADHD. You got to modify what you do in terms of mindfulness training to adapt it to the needs of adults with ADHD. And some approaches have a little bit more explicit focus on sort of the emotion regulation piece, which is important for folks with ADHD too. And then, of course, there's some interpersonal pieces too. Sometimes more explicitly looking at the impact of ADHD on relationships and integrating social and communication skills. There are approaches that are for couples, right? Sort of Brian Wims at the Ohio University. Let me be specific. There's two different ones. Some of his approaches bringing in more the interpersonal aspects. But yeah, again, long answer, sorry. But to wrap up, organization, time management, self-motivation, and then those kind of cognitive pieces where you're looking at what are the things that are getting in the way of those self-regulation skills.
And Laura, when we're talking about, these, whether it's more like explicit or needing to adapt certain ones, or the ones that translate really well, I'm curious. One of those core experiences, I think, with CBT is the thought restructuring. And does that look the same for adults with ADHD?
Yeah, that's a really great question. And I think there's one key way that it probably should look different. Now, in terms of like what strategies you use, I'm not sure that it's a strategic, but it's more kind of how you're relating to the thought. And what I mean by that is, because some of these thoughts can be quite positive in valence. I'll give you an example that I've written about a lot. One of my wonderful clients I worked with when I was a trainee, he discovered one of his, what I now would call avoidant automatic thoughts was, I'm a good person, so this is all going to work out for me. Which is a wonderful thought, right? But he discovered through our work, yeah, that's my red flag. Like when I have that thought, that means I'm about to do something that is impulsive or is not maybe servicing me in the future. This was a guy who would admit he was very much like a people pleaser as well. So like there might have been some, let me just overpromise or let me sacrifice myself for another person, So in that example, myself and my colleague, John Mitchell, who also does work in the space, we wrote this paper called Incautiously Optimistic. And that was kind of our first paper to try to look at some of these quote unquote overly positive thoughts. And what we really emphasize is like, you should focus more on the function of the thought versus like the valence of the thought. So I would not want to be sitting there with this client, having them ask themselves whether the thought that they're a good person is rational or not. Like, that's not fun. I don't need you to be talking yourself out of the idea that you're a good person. Like, that's not how I would approach that. So I think because sometimes you've got these not explicitly negative thoughts, really focus on like, okay, that could be true, but like, what is that thought doing for you in the moment? Like, what's the behavioral outcome? So and this is my personal bias as a therapist anyway, I'm much more like, act Steve Hayes, what's the function of the thought anyway? And so I think that model works really well with this population because they don't get caught up in like sort of, is this true or not? It's more like, okay, it could be true sometimes that it's good to wait till the last minute. That's the other thing, right? In trying to address avoidance is not always bad, right? Like sometimes we should be avoiding negative things, or sometimes it is strategic to do that procrastivity thing where you're like, I should do this easy thing first. So I don't think it works to be like, you're always, that this thought is always bad or always problematic, but to think about like in this situation, I think you talked earlier about an example where it just causes you to stop and reflect and be like, okay, when that client had that, I'm a good person, so this will all work out for me. It wasn't like, don't think that. It was step back and be like, in this instance, am I, and I will quote a great musical artist from the 1980s and 90s. Should I chickadee check myself before I wreck myself is what I always say, like in that moment. And so, yeah, I think that's my answer. Be a little bit more looking at function than logico-deductive truth of the content of the thought, if that makes sense.
Right. Yeah, Laura, you had mentioned earlier about working in a college, and if I remember right, you doing some research maybe around the academic aspects that come into play. So, although I have a college daughter, I don't want to admit she's an adult yet. We're still
emerging adult is the term.
That's right, emerging adult. Yeah. So with the emerging adult population, so like these college students, is this a similar model? Like is similar intervention, or are there are the things around academics? Do we have to take that into consideration? Can you share a little bit about that?
Sure. Thank you. So I also want to shout out some of my collaborators on this work. So Will Canoe at Appalachian State University, Cynthia Hartung at University of Wyoming, and Kate Flory at University of South Carolina. We have worked together to kind of take the CBT model and say, okay, how does it need to be adapted for college students? And we have a manual and workbook out there. And so with our approach, there are a lot of similarities, like definitely these organization, time management, and planning. Like the core features are still there, self-motivation, the thoughts and feelings pieces. But as you say, I talk about college as basically your job is to learn. So you are a professional learner. Right. And so you have to integrate skills that are going to help people who are having to learn a lot of different information, in a relatively brief period of time, and to do that in an efficient manner. And so some of my own work that kind of comes out of my interest in collaborations with cognitive psychologists has been looking at what we call the testing effect. So this is the idea that taking quizzes or tests, and I don't necessarily mean formal paper and pencil, but like doing flashcards where if you can't remember the item, you're not just looking at it, you're sitting there trying to remember it. Basically, we know from cognitive psychology that attempting to pull things out of your memory, it tells you what you do and don't know, but it also enhances memory. So the harder you're working to study by using what's called retrieval practice, the better that memory strategy is going to be. The problem is it feels like hard work, so people don't want to do it. Like that's the challenge. And we know that college students in general, and specifically college students with ADHD, might not use this strategy as much as they could. So some of my basic lab research basically shows that when we bring people in the lab and have them use these strategies, or if we give them sort of a computer interface that supports these strategies, college students with ADHD benefit just as much as college students without. So we wanted to first show this strategy actually does work. And so we add a lot of things in there that are more specific to the college context. So things like the retrieval practice. This could really be helpful for anyone, but one that's really helpful for college students is called the Pomodoro method or the Pomodoro technique. You guys are nodding. You know what this is. Basically, for our listeners, just Google Pomodoro. I call it as a mega skill or an uber skill because it brings together breaking down tasks, kind of things to keep you on task. It's like a lot of good OTMP stuff like all rolled into one. So encouraging students to use that. You have to also more tailor to the developmental period. So we have more content in there about social relationships. We have content related to negotiating your relationship with your parent. So this is a very modular treatment where you can select pieces that are relevant for your client. So we have things to address that, emerging independence with parents. We have stuff to more lifestyle habit stuff. So sleep, substance use, those pieces, components. And then we have a module in there we just call adulting. That's things like financial management, just managing appointments, like all that stuff that, kind of parents maybe have sort of taken over. And so I do think it looks different in terms of, some of the content that you might address. I will also say for those folks who are working with college students, we found you might need to adapt the length of your treatments. When we try to do 8 to 10 sessions with students in a single semester, it doesn't usually work very well. Like we sort of work in smaller increments. The treatment we developed, it's very flexible, but when we do it, we do like 7. When I work with students in the clinic, just myself, I do 4. I contract for 4 sessions chunks like at a time, just because the semester gets busy. Like I think that works a lot better for that population. And then finally, I just want to call out, I think it's important for us to recognize, that students going to college are only one portion of students who are emerging adults. And I don't think that my field has done as good of a job of coming up with treatments that can be helpful for those emerging adults who are not college bound. And I think that is an area that some of us in the field are trying to work on a little bit more, because we don't want to only pay attention to those students who among the population maybe are kind of the most functional in the sense that they've made it to college. Not that students who don't go to college are functional, but, hopefully you know what I'm trying to say.
Yeah, I love that you mentioned about these kind of contracting for 4 sessions. Like, I find that, I know you were talking about it in the context of college students or emerging adults, but I even think sometimes with adults in general, I have found when we take this big thing and go, you know what, let's just work on this small little thing and let's just get that 100%. Right for 4 sessions. And there's a whole bunch of other stuff. And if you want to do that next 4 sessions,
yes, we
can do it now or we can do it later. And it almost seems like it takes this, and I don't know if I guess a thought of that it could be, it feels never ending for them. Like, it's like, I have so many things I want to work on. And I think this idea of just saying, hey, let's do some micro kind of treatment where let's do it for 3 or 4 sessions. Let's get that working well for you. And then we'll make a decision where to go. I have found that just even outside of college students, that to be more successful with adults that do struggle with the attention or that everything feels like, oh my gosh, like this is going to take me 5 years to accomplish this. And we go, let's focus for a month. Like, let's just see what we can get done. Do you find that as well in your work?
I have not used the kind of micro contracting approach, but now I want to, because everything you're saying, makes so much. And maybe the reason I have not thought of it as much is because a lot of my training is in the context of these manualized treatments where it's like,
sure,
okay, there's this but I think there's so much. First of all, just talking about it, me as the therapist, I feel less overwhelmed. That sounds great. I'm probably going to be more effective, but I do think I agree with all the reasons that you mentioned that it can be helpful. Also, just giving people kind of more potential for a win there, right? Sure. But also, I think it speaks to, a challenge we can sometimes have for people with ADHD, not always, but it can be kind of hard to keep the session on track, maybe more than with some other client populations. And so I think if you have this mutually agreed upon very specific goal, that gives you a little bit easier of like, okay, I hear what you're saying. This thing happened this week, and that sounds like really important. And, is that a thing how does that fit with our goals for the next 4 sessions? And I think with that too, Another thing that I recommend doing is from the outset of the therapy, having an open conversation about like, hey, we're going to get off track. And not saying that's because of your ADHD, but like just because people get off track and things are more urgent, and saying I might get off track, which you guys probably are observing from talking to me. This is a thing that I do as a person. And maybe having between the two of you, like this mutual, like either of us is allowed to sort of call out if we kind of feel like maybe we're getting a little bit off of like what the goal might be, and have a conversation about where we want to go with that. So that is a thing that I kind of tend to do with clients who have ADHD, and maybe would be good for all clients, right? Universal design for therapy. I think that's one thing too that I want to say about this work is that, like I hope we're doing a good job really tailoring it for people with ADHD. But the more I do this, the more I'm like, there are so many different kinds of challenges that clients bring to us, regardless of their diagnosis, where these kind of self-regulation oriented skills could be really helpful. And so the more I do this, the more I kind of been thinking transdiagnostically about just like self-regulation challenges more broadly, and what kinds of strategies can be helpful for those, regardless of what the diagnosis is. Because of course we see this in depression. There's tons of crossover there. I wonder what you guys think about that idea of sort of it being more broadly applicable.
Yeah. I mean, I think the idea of, just the idea of transdiagnostic approaches and that benefit in what I think that's how I've changed my treatment for a lot of things now, and focusing on that. So I do think it has a much broader appeal.
And I can't recall kind of where I had heard this term, but the idea of ADHD takes the lived experiences and like the lived daily challenges, and it's just they tend to experience them more often, and potentially more intensely. But that doesn't mean that it's not universal experience. And I think that's where a lot of times we can hear kind of in like just like, oh, like everyone has ADHD, and like, everyone has self-regulation difficulties. It's just individuals with ADHD, we see this coming from a different place. And so I certainly hear the benefit of that, because everyone does have self-regulation difficulties. And it's just individuals with ADHD might benefit even more, but that certainly doesn't mean that individuals without will benefit, are not going to benefit from these approaches here.
Right. And I want to go back to what you said about we still have to take into account that it's not just everyone has ADHD, and these folks in front of us have, validating what you just said, about that, because that is important. So much of what we do as therapists is like, we're just working in the dialectic, right? It's like, how do we help people have enough self-awareness to like do better, but not so much that in a negative way that they feel sort of paralyzed with the self-blame. And this is another example of like, how do I recognize that what I'm experiencing is a part of the universal human experience, but yet for me, and for every person, really, like it's an individualized experience with its own unique challenges, and feeling a sense of validation in that, I guess.
Well, Laura, this has been really great. We could probably keep you all evening, although I guess it's morning for you if you're in Japan. So
it is,
about what, 9 o'clock in the morning?
9:30, yeah. That's I got my
okay. So so as we kind of wrap up, we like to ask our guests kind of two closing questions. One being, if you could recommend some type of content, whether it be a book, a podcast, a movie, whatever you want, but something you think people should check out.
Yeah.
What's something you'd suggest?
So I think I have two. The first one is a YouTube channel by a creator named Jessica McCabe, and it's called How to ADHD. And Jessica, I now know her personally. She's started to attend our Association for Behavioral and Cognitive Therapy's annual conference. And and has worked for a long time with one of my colleagues who is like a CBT therapist. And her content, she has lived experience, of course, but she does an extraordinary job of making sure that what she's putting out for her viewers is empirically supported as much as it can be. And her stuff is engaging, but it's also like really valid from an ecological, right? It's lived, it's real, it's based on the people she works with and things that she gets from her viewers. But then also she really has an eye for it being evidence-based. So I can't recommend her content enough. And then the second one is more of like a recommendation. So going back to when you had previewed this question, I'm a music person, so my brain was like, oh, it's got to be a song. But what I think I might recommend to people that could be fun is when you're listening to music, I'm a lyrics person too, right? So be open to little snippets of lyric that you find like are really validating for particular situations. I sort of jokingly, but almost seriously, that check yourself before you wreck yourself. I had a client who I was treating for phobia once, and we realized that a big part of his change process was realizing that like his fear was sort of motivated by survival instinct, and that that's going to be there being like, oh, hey, like look out for this. And there's I think it's a John Mayer song. There's a lyric that says, fear is a friend that's misunderstood. Right. And so like a little piece of that. So maybe for you yourself or for your clients, like just be open to looking for little pieces that, kind of can serve as almost like a memory trace for particular skills when you might need them. Could be fun.
And we're going to have to now put Ice Cube in the show notes for check yourself.
Well, can I very quickly, I was not allowed to put those lyrics in my book because they're copyrighted, and they would. Right. So instead in the book, it says, one might wish to check oneself before one wrecks oneself, so that I could, which actually is funnier, and I like even better.
That's right. It's right. Yes. Kind of our last question. If you could give 3 takeaways for our listeners that you'd want them to kind of hold on to from our conversation, what are your 3 takeaways?
Yeah. First of all, I think I want to highlight this idea of the potential for creativity to come into your work with your client and figuring out exactly where are their self-regulation difficulties and how can they engineer creative solutions that work for them. That's number 1. I think number 2 is especially some of what Paul was bringing to the conversation about making sure that you are really assessing like what are clients' metacognitions and thoughts about their own use of skills, the outcomes of their own behavioral experiments, and fostering an incremental kind of approach to what success looks like for them. I think that's really important. And this is sort of meta, but I think just conversations like this and collaborations with other therapists, I think sometimes when we're in practice, we don't get as many of those opportunities as we wish we did to sort of discuss the work that we do. And I have gotten great ideas for my own work just from our conversation today. And and also from clients, right? Like, especially in this space of hacks for your daily life, lots of stuff that's in the book are things that I've picked up from clients' successful behavioral experiments. So always just adding to that skill toolbox through the interactions that you're having with other people.
Well, Laura, thank you so much for joining us. This was great. And loved reading the book and having a discussion, and maybe we'll be able to have you join us again to go deeper. So this was great. I love it. Thank you so much. Great.
Thank you.
That's truly, I feel like just in some ways we're just scratching the surface on so many different pieces, and to maybe echo just those different hacks and the tools in the book. You mentioned it briefly, but I really appreciate the one that was like, going into your environment and setting and beyond just visual distract, like what are those pieces, and like being able to we're just going and collecting data and doing that. Like I was like, that is brilliant. And I was not even aware of not even on my radar. So actually since then I think it was 2 individuals this week sending them some homework of like, okay, so
cool. And it's
so
kind of
many different
honoring
pieces
them
to
as
the
a
book. I really
client,
appreciate
right?
that.
To be curious about themselves, and they are worth the attention. Yeah.
Yes. And I'm interested to hear the feedback that they bring back in. Yeah. So I truly appreciate that. Really appreciate you talking about, living well with adult ADHD, practical strategies for improving daily life. And, Laura, if our listeners are interested in like learning more, staying up to date, or following you, is there anywhere they can go to check in to see what you're doing?
Sure. Yeah. Working on this book finally motivated me to create a website. So it's lauranouse.com. And so you can look at the different things I've worked on. I have a page there more for my academic research, speaking engagements, that sort of thing. And I also have quite a number of hobbies that I've included on there too. So feel free to check those out and let me know if you share any of those.
Certainly appreciate it. Hoping our audience takes the time to check that out. And if you're a licensed clinician who would like to use this information, please head over to psyched-to-practice.com or check the show notes for a link to purchase an accompanying exam for a CEU credits for this episode. If you're interested in hearing more or staying up to date with what's going on for Psyched to Practice, you can visit our website, or you can follow us on all major social media by searching Psyched to Practice. We'll be back in 2 weeks, but until then, be well and stay psyched.